Dr. Henry, would it be incentive for people to get the vaccine to outline things that people can do when they're vaccinated that they can't do when they're not vaccinated? And do you foresee at some point in the near future, providing advice to people that have the vaccine that they can do things differently? And are you worried that people may just do different things because they feel they have that extra protection from the vaccine?
Yeah, we're in that very challenging place right now where we have a lot of people, over 30% of adults who've had a single dose of vaccine. We know it takes time for your body's immune system to develop the full immune response, and that's 2 to 3 weeks we know now. We know that because of what we've seen in long-term care and in healthcare workers. So yes, there are some things that we will be able to do, but right now there's not enough of us who are protected with vaccine that we can start on that road yet. We know that there are some people who are getting infected. We are still having outbreaks in long-term care homes, although thankfully much, much less, and they're not spreading as much, and the illness is much milder. But we have seen as well in some communities where we have immunization, it doesn't mean the disease has gone away completely. Your chances of being infected go down dramatically, but it's still not zero. So right now, because we have so much transmission, especially with new highly transmissible variants in a lot of places, we all have to hold the course for a little bit longer. But yes, we will get to the point where, when we're protected with immunization, we'll be able to have people in our homes, to see our grandparents again, our family again, in small numbers. And then as more and more of us are protected, we'll be able to have groups come together again safely. But right now, we're in that uncomfortable position of not having enough protection at a community level that we can let down our guard. And we've seen, unfortunately, that's meant that people have ended up in hospital and in ICU. So yes, there is a horizon out there, and we can see it. We can see it. By the end of the May long weekend, we're going to be in a different place, and we'll be able to start thinking about how do we get our arts and culture and sports and other things going again, because we have enough protection that we're stopping transmission in the community and stopping those people who are most vulnerable from infection from getting sick. So we are working on it on a national level as well as across the province here. What does it look like to be in a world where most people are protected from vaccine? And one of the things that we think about it, and I butcher a number of metaphors in this, but if a virus infects a tree in the forest and nobody goes to hospital, that's where we need to be, where this is another respiratory illness that most of us are protected, our healthcare system is protected, and we can manage if there's sporadic outbreaks that happen in the future. And we will get there. We will get there, but we have to be patient.